Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 natural, powerful treatment for tennis elbow that you can do it at home to relieve or get rid of tennis elbow. Before I do that, we need to understand what is tennis elbow and the normal healing cycle for the body, so it will make sense that this treatment actually treating the root cause of tennis elbow. And I have other link of the 9 common ineffective treatment that used by healthcare providers. I will leave that link below, so it will make sense why you should not avoid the treatment that doesn't work and focus on the treatment that treat the root cause of tennis elbow. So when you have a tennis elbow or lateral epicondylitis, you usually have damage to the area on the outer side of your elbow. So I'm going to go over the normal healing cycle, and the same process happen internally with the tennis elbow, but we don't see it. But it will make more sense when we look at the external paper cut to visualize what's going on internally. So when you have external paper cut or tennis elbow from repetitive strain injury, the first stage of healing is inflammation. During that stage, you start to have swelling, redness, the blood start to rush to that area and experiencing pain. And you see it here in the paper cut image. The second stage of healing is a proliferation stage. During this stage, actually, our body start to build fibrotic tissue or scarring. During the proliferation stage, our body start to build fibrotic tissue or scarring to heal that open cut. And the same thing happen internally when you have tennis elbow from repetitive strain injury. You start to have a micro tear like here. And the second stage of healing, proliferation stage, your body has to build fibrotic tissue in order to heal. Think about this way. Fibrotic tissue is the glue that glue any strain or any tear in a muscle or a tendon or a ligament. So during the maturation stage, our body gets rid of everything that's related to the proliferation stage or the inflammation stage. So why scar tissue could be an issue, for example, because our muscle should act like a rubber band when it contracts and relaxes, stretch like this. So when you have fibrotic tissue, it's like you have a knot in the muscle, and when your muscle contract, will not stretch much. And that's why you have pain with the range of motion of your wrist and your elbow, because your muscle is not elongating enough to be comfortably do the motion. So when you have tennis elbow for very prolonged period of time, 2 weeks, 3 weeks or more, and the symptoms has not been decreased, actually getting worse or stays the same, that's a sign that you are going back and forth between the inflammation stage and the proliferation stage, back and forth here. So in order to treat the root cause of the problem, we have to work on the healing cycle. And underneath this video, I will go over 9 ineffective treatment that's commonly used, so you're not really wasting your time or money on it. But in this video, we'll go over the most effective approach for tennis elbow. To treat the root cause of the problem, we have to address the inflammation. So first thing, when I work on inflammation, the first thing I do is rest. If you're resting for 2 weeks and your symptom has not been decreased, that's an indicative that you have a chronic condition of tennis elbow and you're going back and forth between inflammation and proliferation. So resting is not going to be enough during that time, because you have severe inflammation, severe fibrotic tissue that you need to address it. So the other thing I use with my patient, I use a Magna Heal 2. That's a very strong magnet that penetrates 3 to 4 inches in the body to decrease inflammation, and I will have them wear it throughout the day or at night to decrease internal inflammation. Very effective to decrease inflammation. At the same time, I like to put my patient on anti-inflammatory diet, because when your body going back and forth between inflammation and proliferation and you eating inflammatory food, that will make the inflammation worse and slowing down the normal healing. The other thing I like to do for inflammation, because I notice with a lot of the patient that has chronic tennis elbow, they usually have vitamins mineral deficiency, and the body will not heal fast if you have, for example, those just example, if you have vitamin B, C, D, magnesium, zinc deficiency, your body is not going to transition very easily from inflammation, proliferation, maturation. You're actually going to go back and forth between the inflammation and proliferation. So for very severe chronic condition, usually those patients experience severe deficiency in vitamins and minerals and hormonal imbalance that make their body stuck between inflammation and proliferation stage. To really get to the root cause of the deficiency, we have to do proper nutrition evaluation to get to the root cause of the deficiency. So the first powerful treatment, we have to get rid of the inflammation. The second powerful treatment, we have to get rid of the fibrotic tissue, the scar tissue. So when you look at this image, the first image here, that's when the muscle look like nice, normal, without any tear or strain. The second image for the strained muscle, and when your body starts to build fibrotic tissue, it's actually look very random internally like this. And actually, I want you to try this at home to feel the fibrotic tissue. So muscle should feel like pliable, like meat. When you have fibrotic tissue, you're gonna feel gnawed like a rock in the tissue. So you wanna go to the lateral part of your elbow and feel. And if you start to feel like kind of like you're going over very firm hard tissue, very high chance that's fibrotic tissue. And that fibrotic tissue need to be breaking down to decrease that fibrotic tissue, so you will have more range of motion. So what I personally do with my patient is using the A3 to work on breaking superficial fibrotic tissue in the whole area. And I use the A5 to go deep enough to break fibrotic tissue that deep in the muscles. So at the same time, while I'm working on the inflammation, I work on the fibrotic tissue. And it's very important, the treatment is effective if you implement the three element of the treatment, which is the fibrotic tissue and the inflammation, and lastly is the fascia restriction. You cannot pick and choose. I'm gonna work on the inflammation only. The inflammation will not decrease the fibrotic tissue, and if you break the fibrotic tissue, that's not release the fascia restrictions. So what is fascia? This is extremely very overlooked by a lot of healthcare providers because there is not a lot of good education on how to treat it effectively. So next time when you go buy meat and you see that white filament in the meat, that is actually the fascia layers. So when you have fascia restriction, and then that's another image for the fascia, you will see here the white filament, that's actually the fascia layers. So to make things complicated, but don't worry, the treatment is very simple. We have two categories of fascia: superficial fascia and deep fascia. And the deep fascia is actually divided to four subcategories: apparatic fascia, epimysin, premiysin, endomysin. And you can see it here in this image, that you see layers of fascia that wrapping a group of muscle, individual muscles, and individual fiber here. So when you have fascia restrictions, for example, like superficial fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. It restricts the range of motion. It compresses on everything. And when that happens, that will limit the range of motion. And when you start to have fibrotic tissue, usually that fibrotic tissue glued the fascia layers together. So we have to simultaneously work on inflammation, the fibrotic tissue, and the fascia restrictions. So what I personally do for releasing the fascia, I use the A1 to release superficial and apparatic fascia. And I have to go deep enough to release the epimysin, premiysin, and endomysin. It's very important to understand that you cannot pick and choose one or two fascia layer and assume that's gonna solve the problem, because it's a very common when someone has fibrotic tissue or fascia restrictions, it occur in most of the layers of the muscle. So for effectively to treat tennis elbow, we have to address the healing cycle from inflammation, decreasing the inflammation, decreasing the fibrotic tissue, and releasing fascia restrictions. If you have any question or comment, leave it in the comment section and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.